Hi friends and dear students, welcome back to my YouTube channel. In my today's lecture, I will discuss with you regarding bereavement. मैंने पिछले वीडियो लेक्चर में आपके साथ ग्रीफ के रिगार्डिंग डिस्कस किया था। उसमें हमने डिस्कस किया था कि ग्रीफ क्या है, टाइप्स ऑफ ग्रीफ रिएक्शंस क्या हैं, ठीक है, उसको हम कैसे स्टेजेस क्या हैं ग्रीफ की और कैसे हम उनके कोपिंग अप कर सकते हैं, ठीक है। सो वो सब चीज़ें हमने लास्ट वीडियो लेक्चर में डिस्कस की थी। उसी की कंटिन्यूएशन में मैंने आज का लेक्चर प्रिपेयर किया है, दैट इज़ रिगार्डिंग बेरेवमेंट। सो आज मैं बताऊंगी बेरेवमेंट क्या है हमारे पास और कैसे जो है वो ओल्डर पीपल जो है वो बेरेवमेंट प्रोसेस के थ्रू खुद को कोप अप करते हैं और कैसे स्टेजेस हैं बेरेवमेंट की, ठीक है। सो ये सब चीज़ें आज के लेक्चर में डिस्कस करते हैं आपके साथ। सो लेट्स स्टार्ट विद आवर टुडेज टॉपिक, दैट इज़ बेरेवमेंट। So let's start with the topic bereavement. Bereavement is the period of sadness and loneliness that we experience bereavement. We are trying to adjust to the loss. We typically associate the feelings of loss during bereavement with the death of a loved one. However, the loss can be due to many factors. ठीक है। सो bereavement क्या है हमारे पास? एक टाइम पीरियड है जिसमें हम सैड फील करते हैं, लोनली फील करते हैं। वो हमारा एक एक्सपीरियंस है जो हम एक्सपीरियंस कर रहे हैं, ये चीज़ें कि हम सैड फील कर रहे हैं, हम लोनली फील करते हैं और हम एडजस्ट होने की कोशिश करते हैं अपने उस लॉस के साथ। तो जो भी हमारी फीलिंग्स हैं जो एसोशिएट होती हैं उस लॉस के साथ, सो दैट द टाइम पीरियड इज़ नोन एज अ bereavement. How does bereavement affect older people? Older people's response vary greatly, and coping with the loss is not necessarily a byproduct of being older. Other losses in an older's period life will affect how they grieve the loss of someone close. Existing health conditions, communication and cognitive difficulties, reduced social support, changed living arrangements, that is moving to shelters, housing, financial difficulties. However, people will also experience aging in ways that will help them and adapt to losses. Reciprocal support of and for family and friends, better health for longer, financial stability, ability to work or contribute to society in a range of ways. Next is effects of bereavement. Physical effects of bereavement often include difficulty getting to sleep, vivid dreams, and long periods of wakefulness, may lose appetite, and some people feel tense and short of breath or edgy and restless. Others feel show and lethargic. Next is emotional effects of bereavement include grief, emptiness and depression, anger, fear or mixed feelings. Next is the social effects of bereavement may include feeling detached from others, isolating yourself from social contact and behaving in ways that are not normal for you. Spiritual effects of bereavement may include questioning the reason for your loss, the purpose of pain and suffering, the purpose of life and the meaning of death. Next is the 4 stages of bereavement. Experts generally accept that there are 4 stages of bereavement. First is accepting that your loss is real, then experiencing the pain of grief, adjusting to life without the person who has died, and last, putting less emotional energy into grieving and putting it into something new. Next, coping with bereavement. How we can cope up with the bereavement process? Do try to prepare yourself in advance of death and do express your emotions to others. Take great care of yourself. Try to guard against accidents in home and ensure your home is secure for children especially, and ensure to consult a doctor if your health is a worry, and don't let family or friends hurry you in making important decisions. Don't enter into any financial arrangement you don't understand. Don't allow the funeral rituals to be expensive. Don't turn to drugs, alcohol, or smoke. And don't move your home while you are still grieving, and take it at your own pace. Don't hurry the healing process. So, this is all about my today's topic, that is bereavement. And if you really liked my today's video, then please like video and share it, and also subscribe my channel, and don't forget to press the bell icon. Thank you.